Hello guys, today I'm gonna talk about another rare disease. You will find out some medical facts about this rare condition that affects the skin. It is called Elastoderma, and people affected by it generally have increased laxity of the skin covering a specific area of the body. Decreased recoil of the skin has also been reported. Although any part of the body can be affected, the skin of the neck and extremities, arms and legs, especially at the elbows and knees, are most commonly involved. The exact underlying cause is currently unknown. However, it generally occurs sporadically in people with no family history of the condition. This uncommon condition causes localized patches of loose, sagging skin. Due to the reduced laxity of the skin doesn't return to its original position after stretching or pinching. This can result in complications such as secondary infections and recurrence after surgical treatments. Who gets Elastoderma? Elastoderma mostly occurs in adolescents and adults. Both genders, males and females, are affected. Individuals worldwide of all racial and ethnic groups may be affected. The incidence of the condition is extremely rare. What are the risk factors for Elastoderma? Actually, there are no risk factors currently available for Elastoderma. It is always necessary to discuss this with one's healthcare provider. What causes Elastoderma? The exact cause of the Elastoderma is unknown. In acquired cutaneous conditions, it is believed that there are abnormalities present in the production of the skin protein, referred to as elastin, that may be the causative reason. Elastin is a highly elastic protein that is present in connective tissues. This gives a structural support to many organs that help return the skin to its original position when it is stretched or poked. In the following video, you will see a man called Gary Turner, a Guinness World Records title holder, after embracing his very unique ability. Due to a rare skin condition, Gary has the world's stretchiest skin. Gary first set his record back on 16 October 1998 on the set of Guinness World. He suffers from a rare syndrome called Ehlers-Danlos syndrome, which can mimic the clinical aspects of Elastoderma but can easily be distinguished from it by histological examination and by revealing changes in the biochemical structure and synthesis of collagen fibers, resulting in a relative increase in normal elastin fibers. Due to lack of recorded real cases of Elastoderma, I have chosen parts of Gary Turner's show on TV so you can just see the unique stretchy skin this syndrome causes.
Show me a little something. Let me pick. Your neck. Can I pull it? Go on then. Off you go. Oh! God. When did you find out you could do that, girl?
I was probably about 8 years old, messing around at school, and I asked a friend next to me, "Can you do this?" I replied no, and that's when I realised I had something special.
Is there a reason you can do that? What's the reason behind it?
I have a very rare skin condition.
Does it hurt?
No, not at all.
Okay.
What are the signs and symptoms of Elastoderma? Signs and symptoms can vary from one individual to another, and that includes the presence of skin patches that are very loose or stretchy in any specific area of the body. Decreased skin recoiling is seen, skin returning to its original position. Itchy and red rashes. Skin lesions in the form of papules, elevated areas of the skin that are well circumscribed, and nodules. Premature wrinkling of the skin, increased sensitivity of the skin, and bacterial skin infection. How is Elastoderma diagnosed? Elastoderma may be diagnosed by the following tests listed below. Complete physical examination based on the medical history of the parents. Dermoscopy is a diagnostic tool used when the dermatologist examines the skin using a special magnifying lens. wood lamp examination procedure in which the healthcare provider will examine the skin using ultraviolet light. It is performed to examine the pigmentation changes in the skin. A biopsy of the skin is taken for laboratory investigation that is performed by the pathologist. The pathologist examines the skin tissues under a microscope and gives an accurate diagnosis. Doctors may perform additional tests to confirm the diagnosis and rule out other clinical conditions. What are the possible complications of elastoderma? Complications of elastoderma includes the following: cosmetic concerns, skin ulcerations, individual with low self-esteem, secondary bacterial and fungal infections. Complications can occur with or without the treatment and in some cases due to the treatment. How is elastoderma treated? At present, there is no treatment for elastoderma, but the healthcare provider may help by considering the symptomatic treatment that include the following: sufficient skin care. Patients may undergo cosmetic surgery to treat the symptoms of the skin and improve their physical appearance. Regular intervals of medical screening at periodic intervals with physical examinations and tests were recommended. How is elastoderma prevented? No guidelines or methods are available to prevent this condition because the risk factors and the appropriate cause of the elastoderma are unknown. What is the prognosis of elastoderma? The prognosis of elastoderma may depend on the severity of the signs and symptoms associated with complications. However, the condition can be corrected by removing loosened or hanging skin. Laxity can reoccur though. Thank you guys for watching the video. There isn't enough information available about the disease I just talked about. I hope this video can help a bit to introduce it more widely. Please subscribe to my channel and I will do my best to provide worthwhile information about more rare diseases.